So with the respiratory system, the first thing you should know, you'll see on page 291 at the beginning of the lab exercise 23. I did not mention this in lecture, but well, I did mention it in lecture, but it's not on this PowerPoint. No pulmonary ventilation, external respiration, transport respiratory gases, and internal respiration. The four processes referred to as respiration. So know those four as well. Then you should also know the structures that fall into the upper respiratory tract, as well as those structures that fall into the lower respiratory tract. And again, the larynx is an area of contention sometimes, but for our purposes, we will throw the larynx into the lower respiratory tract and everything below. So as you see on the left, know the various parts of the nasal cavity, the oral cavity, know the sinuses, conchae, trachea, esophagus, parts of the heart and soft palate, openings of the auditory or eustachian tube, tonsils, etc., parts of the pharynx, nasopharynx, oropharynx, and laryngopharynx, and again some of the major cartilages of the larynx that you can see on this midline section. You can see the epiglottis, the thyroid cartilage, and the cricoid cartilage. So be able to label a mid-sagittal section through the head, as you see here. On this slide, again, be able to label the major cartilages, the thyroid cartilage, cricoid cartilage, and the epiglottis. Be able to name at least the arytenoid and corniculate and cuneiform cartilages. Remember, you've got three singular large cartilages, the first three I mentioned, and then three paired cartilages, the last three that I mentioned, for a total of 9 cartilages involved in the larynx. Again, be able to label a diagram, basically the vocal folds, know them, as well as the glottis, which is the opening between the two, and again, no vocal versus vestibular folds, or the true or false vocal cords. And you should, again, look for the epiglottis as well. That'll tell you whether you're looking at a laryngoscope, like it'll give you a perspective what is anterior, what is posterior. And again, know the cartilages that you see down at the bottom that open and close the vocal cords, the vocal folds. The arytenoid cartilages, again, small cartilages, but you should know that that's the function of the arytenoids. They open and close and change tension on the vocal folds. So again, be able to label a diagram if you see something like this, from the larynx on down to the lower respiratory tract. Remember, you've got the midline trachea with the C-shaped cartilaginous rings, and the trachea bifurcate at the carina. Again, the carina is an important landmark. The right main bronchus is a little more straight and shorter, and it tends to get lodged, something lodged into it more often than the left main bronchus. So just, again, fun facts there for you. Know that the right lung has 3 lobes. The left lung has got 2 lobes. So when you look at your bifurcations of the bronchi, again, your first split from the trachea, you've got your main or primary bronchus. The next split is the lobar or secondary bronchus, and you'll have 3 of those on the right side and 2 of those on the left. So they split into the lobes. The next bifurcation you'll see is named segmental or tertiary bronchi, that split into the segments of the subdivisions of the various lobes. From that point on, you can have as many as 15 to 16 different levels of branching before you reach the of bronchioles, before you reach the terminal bronchiole. And again, the terminal bronchiole you'll see on the next next slide or two as well. So looking at a naked bronchial tree with no actual lung tissue around it, you get a better feel for how like short and branched the the bronchi are. Again, take a cross section through one of those, and you see this C-shaped cartilaginous ring on the lower right side of your slide here. Again, this was our sample for hyaline cartilage, and you've got this trachealis muscle that kind of changes tension. It keeps that the ends, that cartilage attached to itself. The other thing you should know is mucosa. Again, if you look at the diagram kind of upper right, you've got goblet cells, ciliated cells. These are ciliated pseudostratified columnar epithelia as well. So that's again kind of I think first semester stuff as well. You should kind of be able to recall. Okay, so looking at a terminal bronchiole and beyond, the terminal bronchiole is the last bronchiole before you get to what's referred to as a respiratory bronchiole, where you see your first alveolus kind of pop off the side of the bronchiole there. That's where you refer to as a respiratory bronchiole. The alveoli is where respiration takes place. So anything beyond that, that alveolus is referred to as a respiratory bronchiole. And everything up to that point has been also part of the conduction zone. If you remember those terms from, I'm sure they're probably covered in lecture, but the conduction zone versus the respiratory zone. All right, conduction zone just brings air to the alveoli to be respired, and again, that is kind of your dead space. If you think ahead to the next chapter in spirometry, there is so much just dead space within the bronchial tree that you can't ever really exchange those gases. All right, so from the respiratory bronchiole on down, that is the respiratory zone, and again, the next kind of branching as the alveolar ducts that lead into the alveolar sacs, these large clusters of alveoli, and that's where you'll have the exchange of gases within the alveoli. The other thing to take note here on this slide as well are the bronchial artery, vein, and nerve that you see that travel through the bronchioles. Again, the kind of like how the heart did not use the blood that actually traveled through it. The cells, the smooth muscle cells of the bronchioles, they do not use the gases that pass through the bronchioles, and it's separate from the pulmonary arteries and vein set. You have a kind of a systemic artery and vein set for the bronchioles to serve the smooth muscle of the bronchioles. Again, that's another trend that you want to kind of take note of as well, as the bronchioles branch more and more and more, and the bronchioles get smaller, smaller, smaller. The cartilage it changes from kind of C-shaped to just being plates to just being smooth muscle, as you see here. So eventually all the cartilage on the bronchial tree will be replaced by smooth muscle, and that's where you get your vasoconstriction and vasodilation regulation occurring at a very, very small microscopic level. Okay, so kind of taking an alveolus and blowing it up and magnifying it here, we can see the different types of pneumocytes. You should know those. The type 1 alveolar cell or pneumocyte is just the simple squamous epithelia. The flat cell that makes up the alveolus itself. This is the cell that gas diffuses through on its way from the alveolus into the blood. Type 2 alveolar cell or pneumocyte, this is the one that secretes surfactant, and remember, surfactant is what allows that alveolus to actually be a bubble. It prevents the alveolus from collapsing in on itself due to the surface tension of water. If you remember, surfactant reduces the surface tension of water and allows water to basically be more wet, if that makes sense. But it helps to basically soaps are surfactants. They help to again, allow water to surround small molecules. So without the surfactant, this alveolus would collapse in on itself. The other thing you see here are macrophages, or you'll sometimes see this referred to as dust cells, D-U-S-T. The basically specialized macrophages that you find only within the lungs. Okay, so you take that little box there, you see the boundary between the air and alveolus and the blood and the capillary, and we're going to magnify that and take a look at that. Okay, so this comes from a different textbook, but it is the same concept. The boundary between the alveolus and the capillary, and if you look at subphotos B and C there, they kind of show you what they're looking at. The respiratory membrane, if in different textbooks, will be kind of hashed out differently. I've seen one respiratory membrane list that has like 7 different items within it, but we're going to keep it as simple as possible. We're just going to call it the alveolar epithelium, the type 1 pneumocyte that we talked about earlier, the simple squamous epithelia that makes up the alveolus, the simple squamous capillary endothelium, the simple squamous cell within the capillary of the blood cell, or within the capillary itself that makes up the cell wall, the tunica intima of the capillary, and the basement membrane of the two that is fused. So we're just going to call our respiratory membrane a 3-part membrane. It's just going to be each of those epithelial cells, the capillary epithelium, capillary endothelium, alveolar epithelium, and the fused membrane between the two, the basement membrane. So that is our respiratory membrane. That is the membrane that gases have to diffuse through in order to get from the air that we have just inhaled into our lungs, and into the capillaries, or vice versa, from the capillaries back into our lungs to be exhaled. Okay, so know the hilum of the lung, and kind of what it is and what is there, what's entering and leaving. You've got pulmonary arteries entering, which you see is blue because they're, again, not oxygenated yet. Pulmonary veins leaving, as nice and red and oxygenated, and you also have the primary bronchi entering each lung. So remember, the trachea is lung free. The trachea splits at the carina, and then the left and right primary bronchi enter the left and right lungs at the hilum. The other thing to kind of take note, as you see, the left lung has the cardiac impression, cardiac notch, and the heart does sit a little more into the left lung than it does the right. So just, something else to kind of take note of. You should kind of know the muscles of expiration and inspiration. Of course, the diaphragm but that's what we refer to as quiet respiration. If you're exercising any at all, you will have your scalenes, pectoralis minor, external intercostals involved in inspiration, as well as your sternocleidomastoid. Anything that lifts the ribs up will be involved in a muscle of inspiration. And muscles of expiration would be anything that pulls your rib cage down, which would be your internal intercostal set and your abdominal muscles, your rectus abdominis most specifically. So anything that pulls your rib cage up assists in inspiration, and anything that pulls the ribs down assists in expiration. So you should be able to identify the structures that you see within a transverse section of the thorax, as you see here. This is an area just below the carina. As you can see, you've got your left and right primary bronchi that enter the lungs, just anterior to the esophagus. The trachea is not there. It would be just anterior to the esophagus if it were. What you are looking through with regards to blood vessels is basically the pulmonary trunk. You've got the pulmonary trunk splitting into left and right pulmonary arteries, and you can see some of the pulmonary veins, left and right, returning back as well. Again, those three are structures at the root of the lung. Again, the primary bronchus, pulmonary artery, and pulmonary vein. Those are the three structures that enter the root. Those are the three structures that make up the root of the lung. They enter at the hilum. Again, take note of blue and red lines, the visceral versus parietal pleura, and the visceral versus parietal pericardium. Again, there is an area where the two are closely associated with each other, but just know what each surrounds and attaches to, and things like that.